All right, over to you, Annie.
What they did. 'Cause that's what
Welcome,
it is.
everyone.
Oh, that's
Um,
better.
She has a, oh,
and I think if we can just mute for those of you entering the room, but welcome. We've got a special edition of Equity in Infant Feeding and Family Health, Bridging Gaps from Birth to Breast. We've got an engaging panel discussion tonight that's going to talk about enhancing healthcare provider understanding and practices in lactation support across diverse populations. Hopefully you're in the right spot. We'll be focusing on interdisciplinary collaboration and innovative approaches and practical solutions to bridging gaps in care from birth to breastfeeding. Since 2018, Breastfeed Durham, formerly known as Breastfeeding Family Friendly Communities of Durham, has strived to support all Durham families with a focus on health equity. Breastfeed Durham hopes every family in our community understands the benefits of breastfeeding and is able to make informed decisions. The mission of Breastfeed Durham is to support a more breastfeeding and family-friendly Durham by advocating for policies and practices that support breastfeeding, chest feeding, and human milk feeding as outlined by the World Health Organization. We have some amazing panelists this evening that I'd like all of us to introduce and meet. If we could start with one and then kind of popcorn around to each of you, I will start with Love.
Hello. My name is Love Anderson, and some people call me the breastfeeding busybody of North Carolina. I work with a variety of breastfeeding support organizations. I came into this work as a mom. My professional background is in math, and I used to teach high school here in Durham. And before that, I ran a startup like so many people in their 20s at RTP, and that was perfectly fine until I had my baby. And I had a baby with special needs, and it turns out that the cost of childcare costs more than my take-home salary as a teacher here in Durham. So we had to make new plans. My spouse ended up working two jobs, and I ended up staying home. And what happens when you have one baby? Surprise, we had another. And then we were very busy. But I was missing my time in the community, connecting with parents, and I wanted to start volunteering because again, I needed to be home, but I wanted a place that would let me bring my kids. And one of the places that had been the most supportive and most transformative was lactation, which is an international peer-to-peer lactation support group. And it was one of the only ones, it was the only one in Durham, and there were very few. There were 16 support groups in Chapel Hill, if that gives you a sense of the difference that was happening. And there were two meetings in Durham, and I went to the one in the day. And Lachely was incredibly supportive, but I found that it had barriers. I wanted to be able to support parents going back to work, and I saw all these system problems, and I asked everybody if they could help solve this problem, and it turned out it was outside of the scope of everyone. So that led to myself and a coalition of healthcare providers and frankly angry parents forming this coalition that became Breastfeed Durham. And I still volunteer with the Leche League, and I came into this work as a volunteer, but eventually we filed a 501c3 and got contracts. And I'm now employed by Breastfeeding Family Friendly Communities, our parent organization. We do business as Breastfeed Durham and Durham, Breastfeed Orange and Orange County. And as a result of that work, I became elected chair ultimately of Breastfeeding Family Friendly Communities, and now chair of the North Carolina Breastfeeding Coalition, which I volunteer for that. And my term ends in 18 months, so it's open, just letting you all know.
Love, do you want a popcorn or you want me to
Oh,
choose?
you choose, go ahead.
Next on my screen is Nikki, if you want to introduce yourself.
Yeah. Hey, everyone. My name is Nikki. I'm here as the Lactancia Latina Coalition Coordinator from Breastfeed Durham. My journey to this point starts when I trained to become a birth doula several years ago and started working with Spanish-speaking families. My mom is from Peru, and so I grew up speaking Spanish with that side of my family. And I started to realize just how many barriers there were to care for Spanish-speaking families in general in the US. And I got really interested in what happens to parents after birth. And so my journey also took me down the road of going to medical school, and I started at Duke a few years ago, and I'm still finishing that up. But in the meantime, I really wanted to learn more about the postpartum period and lactation specifically, because I felt like everyone had questions about how can I fix this problem? My baby's not latching. I'm nervous about this and that. And so I decided to pursue lactation training of my own, and I finished my pathway to IBCLC training a few months ago, and I'm sitting for my certification exam in a couple months. But in the meantime, I got involved with Breastfeed Durham because I really wanted to see how I could help out the Spanish-speaking community specifically, as it has to do with lactation and the postpartum space here in my new community of Durham. And I've had the most wonderful time working with Love and Bernadette and the other folks on this call, trying to kind of close some gaps that we have in lactation support with our Hispanic families here. And I will popcorn to Bernadette.
Good afternoon. Well, good evening, everyone. My name is Bernadette Green. I am the Executive Director of Breastfeed Durham. My journey started as a 16-year-old teen with my first child, breastfeeding, and so I breastfed all 5 of my children. And it also started from going to being a volunteer at Head Start FCR in the health department. And they said, well, we have a program that we just started. I would like for you to be a part of it because you already breastfed 5 of your children. And so that's when I met Love, and I've been with Breastfeed Durham ever since 2018. And also as a community health worker, working in my community, helping out feeding, helping out getting the resources out, as they call me, the resource lady, as well as just being able to just let everybody know that breastfeeding is here, that everybody know that breastfeeding is a norm now. It is not what it used to be. Now we want to make it normal now. We want to make it acceptable now. So this is me, and this is the things that I do. And so I would like to popcorn it to Stephanie.
Hi, everyone. My name is Stephanie McCready, and I am the Executive Director of Nourish and Thrive, which is a breastfeeding equity nonprofit. And we are dedicated to making breastfeeding more normalized in the Black community, a community that has some of the lowest rates in the US that is on record. And so I looked at my own experience as a first-time mom, a young mom, and never seeing anybody in my family or my community breastfeed, and knowing that that's what I wanted to do and not having the support. And so I, like Love, joined La Leche League with my second child, and I felt like I had found community, and it was really refreshing to be around other people who had breastfed, because I'd never seen this. And I still didn't see a reflection of myself in that community, or a heavy reflection of myself. And so when I talk to people within La Leche League, they say, well, La Leche League is more support. It's not policy. It's not like actively going after these types of things. And so I still didn't do anything. And finally, I said, I think this is where I'm supposed to be. And I started Nourish and Thrive in 2021. And we are growing. We're so small, but we're growing every year. And my goal is to just continue to help to grow the diversity in the lactation world, and make sure that we have more culturally cohesive or culturally congruent lactation care, so that people in the Black community can have somebody to look to that maybe understands their situation on a more personal level, and to make sure that we normalize breastfeeding and we offer that support that people might be missing as well. And I will just go ahead and I will popcorn trying to look at my screen here to Amber Cruz.
Thanks, Stephanie. I'm Amber Cruz. Like many of us, we find our way through La Leche League. So I am a La Leche League leader for Durham. And since 2020, I've been working with Breastfeed Durham as the chair of our LGBTQ plus committee. So what happens often with these breast and chest feeding conversations is that our entire queer community just doesn't even show up. And that will come up later with some of the questions around community care and bridging that gap, because representation is so important. So what we've been working on for years is getting specific language out, specific training out to better serve our LGBTQ plus families and reaching their human milk goals, which are often a little more varied than your cis het families. And so there is more training and there is more education to happen there. So that's what I do. I like everyone's nicknames. I am kind of that queer lactation lady, like the one, like if there's anything around that, just send them over there. And so we've worked really hard to have vetted and friendly queer resources on our page that's even gotten picked up nationally, because in truth, there really isn't that much out there still in 2024. So we keep working, we keep looking for volunteers, but I love showing up to these spaces as that queer lactation lady who's going to bring up everybody else. I will jump over to Kim.
Good evening, everyone. I'm Kim. I found my place here in grad school. I didn't even know lactation was a field or a profession to go into until I started my MPH, and I did a focus on maternal and child health, and my advisor was a lactation consultant, and she introduced me to this whole nother world and helped me connect with Love at Breastfeed Durham. And I just started off as a volunteer attending the weekly meetings. And then I helped out with the newsletter. And then I eventually talked to Love about starting a affinity group that was more focused on Asian American, Native Hawaiian, and refugee families in the area. In Orange County, we have a large refugee community. And when I started working with that population, I realized there wasn't a lot of lactation support for that community. There's not a whole lot of people in the area who speak Burmese or Karen. And so I found that a lot of the families, they fell through the gaps in trying to seek out lactation support. And so that led me to look into the Pathway 2 program at UNC. And so I started that lactation program and I finished there, and I became an IBCLC recently. And so, I've been trying to figure out what that looks like and incorporating outreach and, expanding the capacity of linguistic diversity in the area. And I also work at Piedmont Health Services as the WIC assistant manager. And so I've been able to combine all of the things I've learned and also my lactation training. And so that's where I'm at right now. I'm still trying to figure it out as I go, but that's where I'm at right now. And I will popcorn over to Angie.
Hey everyone, I'm meeting some new people today. Good to have you, Kim. I know you're down there in Chatham County where I reside. Good to have you down there. So I work with the Novant Health here in Salisbury. I'm still at work today. It's been a long day. I have students. I'm a preceptor site. I have students that actually train with me and I educate them. Pretty much my whole career. I've been in lactation for about 30 years. And I started on a journey when I turned 21 years old and got pregnant with my first son, who's 30 now. And I started out as a WIC participant. I had no one in my family for 3 generations before me that had breastfed that I could speak with and find out. So I was alone in the whole journey. I had a great registered dietitian there at used to be the health department. It was when the health department overseen the WIC office at the time. And started out as a WIC participant, and then the nutritionist took me under her little wing and taught me everything I know about, peer counseling and things. So I started out my first career up in the beginning with WIC as a WIC peer counselor, then become a lactation educator, and then sit for my exam in 2011 and been in private practice at home in Chatham County, and have traveled for my IBCLC, working in hospitals ever since. So, but I'm down here in Salisbury between Greensboro and Charlotte, and commute. So I know a lot of people on here today, or they've been students with me and went on with their beautiful careers. And I look forward to being out there and helping moms, and keeping on with my private practice when I'm home on the weekends, and still being able to love to educate here. And I have a combination with both my children exclusively breastfeeding a total of 6 years, and now they're older and wiser. They're 30 and 22. Um, but I've been helping moms in different diverse populations because I worked with WIC and Piedmont Health Services for most of my career, and did Orange and Chatham County. So I work with a lot with student population. And when Kim mentioned the Burmese refugee population, I did a lot with them when I was with Piedmont and working there in Orange County. So I know it's a lot of work, and I'm glad to have you out there, Kim. It's wonderful. And working in the hospital setting, we see a lot of diverse population too. Been in North Carolina Breastfeeding Coalition pretty much my whole career, and I just love to see how our state is growing, and we're supporting one another and trying to figure things out and learn from every diverse population as much as we can, and give them support in all areas. And it's good to know that we've got someone out there in our communities that we can refer to from the hospital setting. With my experience, I've had experience with private practice, clinical staff education, clinicals with patients, and also with families in the WIC and out in the community, where I really love to shine as a community support. So having the will of connection is so important for me, because when I do those referrals from the hospital, it's knowing where we can have that gap that fills in the community for that patient. So I'm excited to connect and collaborate from where I'm sitting, and get back home this weekend, and be able to meet some people throughout the next few years that we're collaborating with. So I'm just so grateful to be here, and I'm so thankful to have our lactation nation that's out there that we have.
Thank you, Angie. That was so lovely. I think that reminds me, if all of our participants might put just a little bit about themselves in the chat, that might just help us know a little bit more about you too. We'd love to kind of know your background. We're going to use the chat too for questions, but certainly I think this can be a really fluid process of getting to know each other. And like Angie so beautifully put, this lactation nation, kind of relying on our resources, is so beautiful. Alicia, I think we still need to hear from you if you'd like to introduce yourself too.
Sure. Hi, all. My name is Alicia Bailey. I am also an IBCLC. I'm the WIC and Breastfeeding Programs Manager at Piedmont Health. I have been working with the WIC population in North Carolina for 14 years, 15 years now. And the WIC population has my heart. And I love working with all of the WIC families. And I see some other WIC folks on here from other counties, and it's really nice to see some familiar faces. I work on a whole bunch of different grants. Most are maternal health equity focused. I'm on the coordinating committee for the Embrace Project, which looks to address maternal health inequities in rural spaces, and most specifically in Chatham County. Those of you that are familiar with Chatham County know it's a bit of a healthcare desert. There's not a whole lot of resources out there. And the folks who live in Chatham County certainly have barriers accessing resources from other spaces. Siler City is actually the largest Latina population in the state of North Carolina right now. So that's something that we are really proud of, and it definitely adds a unique spin to some of the challenges that our community faces when you look at lactation support. Like Nikki said, there's not very many folks out there who are native Spanish speakers. There's not very many out there that are bilingual. There's not a lot of Latina or Black women in the lactation profession, and that's something that definitely needs to be addressed. And that's kind of one of my big areas of focus and passion is bringing diversity, bringing access, breaking down barriers in some unconventional and creative ways. And I just love seeing all of these lovely faces on this meeting today. So thank you.
We've got some amazing people here with such diverse backgrounds, experiences. I think it's going to be a really rich conversation. I wanted to make sure that myself and Ann Fields, we're our facilitators, moderators for the panel discussion. So make sure that you know who we are, very quick and short. Ann, do you want to go first?
Absolutely. So I'm Ann. I use she, her, pronouns. I am a clinical social worker at Duke Family Medicine and work specifically with our pregnant, postpartum, perinatal population, all of that. And I'm also certified in perinatal mental health. So this is a passion of mine, and so happy to see some great friends on here today.
And I'm Andy Dotson. I am a physician over at Duke. I practice family medicine as well as board certified breastfeeding medicine specialist. Really happy to see everybody here today. We're going to go ahead and get started because we've got just a tight schedule. We're going to talk about kind of 5 different areas within this bridging gaps to birth to breastfeeding. We're going to start with identifying barriers first. So big topic. So to our panelists, just a question that was asked, can you share your experiences or observations about the most significant barriers to breastfeeding support? Nikki, do you want to get us started answering that?
Yeah, sure. Happy to. And I actually just had a conversation with Lunels, who's on here, about this pertaining to the Spanish-speaking community in North Carolina, or at least in the areas that we've been able to support Spanish-speaking families. I think there are a lot of barriers. I think there are a lot of barriers that are common to other groups, like cost of care, transportation, lack of knowledge about where resources are. At the same time, I think when we're talking about the Spanish-speaking community specifically, we're usually talking about first-generation immigrants to the state. And those folks tend to not have insurance, may not have documentation, and thus that leads to a whole nother layer of barriers, because on one hand, there's fear of interacting with the healthcare system in any way, maybe because you're afraid that you're going to get reported or deported. Or there's also this belief too that utilizing government services like WIC, for example, might prevent you from one day getting the documentation, the legal status that you're seeking. And so I think that those are big things that are unique to the Spanish-speaking population and really prevent folks from utilizing services that might be available to them. I think not being able to have insurance because you don't have legal documentation is a huge issue. We've, at least in the Triangle area, we've grown a lot in that insurance can cover lactation support for babies. So on one hand, that's nice, because if babies are born here, then they can maybe they can be seen in a clinic under their insurance. But for folks who are seeking support elsewhere, like, the lactation network is an amazing thing that people should be able to access and maybe get their insurance to help pay for. But one, it doesn't cover Medicaid, and two, and if you don't have insurance, then you kind of really don't have a way to access that if you don't have money to spare. And so I think that's those are like big areas or barriers for the Spanish-speaking community. And on the other side of things, I want to touch on the fact too that there is some bias from providers that when they see Spanish-speaking families say, I'm going to feed my baby both with breast milk or human milk and with formula, I'm going to do los dos, which is kind of like a trope or a stereotype that you might hear in healthcare settings for Spanish-speaking parents, then they might be less prone to put in a referral for someone to get lactation support or help connect them to WIC to get breastfeeding peer support, because they're like, oh, well, the baby's just going to be fed with formula anyway, so they don't really need to use that resource. And I think that that's a huge bias that we need to work to kind of get over and educate ourselves better on. I could keep going, but I'm going to give someone else the podium.
Amber, Bernadette, same question. Barriers you all have observed about breastfeeding support.
For me, it would be the same, almost the same thing as what Nikki is saying. Kind of the lack of a little bit of the lack of knowledge of knowing about the resources that are out here, how it's changed from when, from the 80s and the 90s, the early 2000s, that now we have more resources. We have more information that's out there that can tell you more about breastfeeding. Also, I would say the transportation, getting forth and back and forth to to the WIC office and finding out what WIC can do, and if you can't afford, the breast pump, with your Medicaid or anything. Or also, I would say also going back to work as well. A lot of times in our Black community, we have to go back to work early, and so when we feel as though we have to go back to work early, we tend to stop breastfeeding, thinking it's okay if we just stop breastfeeding, not knowing, like you said, the resource, not knowing that we just passed the new law out, that you can go back to work and you can pump, with the Pump Act, and so it's just more of a culture thing in the Black community. We tend to stop breastfeeding early because we have to go back to work. We tend to stop breastfeeding early because we have to go back to school. So those are some of the barriers in our community right now with the Black community, and the transportation, the Medicaid. So it's majority of it was of everything that Nikki is saying as well. Um, and like I said, the lack of resources, the lack of not knowing what's going on in the community, the lack of the schools are not, it starts from the clinic. It starts from when you first have your child. When you first have your child, are you having the nurse come in saying, pushing the formula, instead of saying, would you be able to, are you, thinking about it, would you want to do it? And instead, some just say, hey, here's the formula. They packed a little bag with the formulas, and so it without asking the moms from the time that they have the babies. So just a little bit of that, which is some of the barriers.
Amber, your thoughts?
Yeah, I'll round this out because with the queer community, it's almost before that, right? So a lot of healthcare providers might not even know the different lactation possibilities of a body. And whenever you start talking about someone who's going through hormone therapies, it's almost like maternal mental health in the 90s. Like, we're not going to touch that with a 10-foot pole, right? So I feel like with our queer communities, we're way back here, where do the doctors even know what's possible? And are they even giving suggestions of, hey, this is possible, let alone, are you using the right pronouns? Are you a safe space for this family to come in? Are you going to judge them when they ask you to use different terminology than you've been using for 30 years? So when we're talking about queer families, queer couples, different dynamics, we're at the barrier of, where is it safe in North Carolina? This community is under attack right now. Where is it safe? Where is it safe to say you're pregnant if you're in a transitioned body, let alone if someone's going to talk to you about how you're feeding that baby from your body? So that's what I'm out here. It's right now is we're still on the education. We're still on the, hey, this is possible and we're here and we're not going away. So that's what I would say at that bottom line, is that because it's not lived experience for so many people in the lactation world, it's not something that is going to sometimes naturally come across your desk until it does, and then you might create further trauma because you're not informed. So it starts here.
Thank you all. moving on to kind of our next section, we're talking about collaborative strategies. So posing the question, what are some successful examples of interdisciplinary collaboration that have improved breastfeeding support in your practice or community? And I'm going to send this to Bernadette first.
For the collaboration for me is getting businesses, going door to door to different businesses and getting them to sign up for being a breastfed welcome business, to accepting that breastfeeding is welcome in your establishment, to also with child cares, going into child care centers and getting them to accept more of the breastfeeding is welcome at a child care center, being able to set up a room for them. So that way the moms or whoever, breastfeeding, chest feeding, whoever wants to go in the room, that they're able to do that, as well as in businesses. And just by spreading the word and getting out there and letting them know that breastfeeding is here. We're here to stay. We're not going anywhere. Putting up the signs, and going to different schools and setting up a table at the different schools and talking to the parents there. So, that's how the collaboration comes together, when you're in a community and actually being a part of the community and actually helping the community, getting to know what's going on and knowing that breastfeeding is here.
Alicia, love to hear your thoughts on successful breastfeeding support that you've seen.
I'm coming from the WIC space, and in recognizing that the WIC population that we work with across the state has very limited access to lactation support and lactation education. So, there may be several or most families that go through WIC, that the WIC peer counselor support team are the only breastfeeding support that they receive. And knowing all of the barriers to accessing WIC services, it's so important to think outside the box. So, some of the things that we have done at the Piedmont Health WIC program over the last 5 or 6 years is bringing WIC into community spaces instead of expecting the community to come to us. So recognizing, where does our community feel safe? Where do they feel heard? Who in the community are the people who are the leaders, who have the trust and the relationships with everybody else that lives in the area? How do we build relationships with those community groups, with those folks? How do we, where do we make the most impact by bringing WIC to those spaces? So some of the things that we've done at Piedmont Health is we have really great relationships with some of our outpatient medical practices. So UNC Family Medicine is a huge practice. So we bring WIC and we have embedded WIC services in an outpatient family medicine practice, so that patients who are coming into that medical facility to receive primary care, there's a WIC person. I like to call it concierge WIC, because there's a person that's just there every day, and she is their one WIC person. They all have her cell phone number. They can call her anytime they need her. It's just one person. And that one person has their back. They have built a relationship. It's that one person that they see every time they need help with WIC, anytime they need help with a formula prescription or they need breastfeeding support. It's the one person. And it makes it so much easier to build that relationships and really support the community when you have that relationship where you're seeing the same person over and over again. Some of the other things that we do is we have partnered with some of the home visiting services in our area. So we send our WIC peer counselors and our WIC nutritionists along with some of the postpartum home visiting community health nurses. So we can bring breast pumps to those home visits. We can do postpartum WIC enrollments on their couch in their living room or in their bed with their 2-day-old baby. We go into the NICU at the hospital. We'll do certifications in the hospital. We'll bring breast pumps to the NICU so that moms who are leaving their babies behind in the NICU are not walking out of there without the necessary education, information, support, and equipment to continue breastfeeding their babies. So those are some of the things that we have really done. Another thing that we found really important, especially in Chatham County, I'm not sure how familiar you all are with Chatham County, but in the past 30 years, there has not been a place to birth a baby in that county. In 2020, a small rural hospital that's affiliated with UNC, Chatham Hospital, opened the maternity care center. It's a 5-bed maternity unit. And it actually almost closed in 2023, I want to say. But before opening, the only position that they did not fill was the lactation support position. So I reached out to the medical director of the maternity care center and offered to partner with them and provide a WIC IBCLC on a contract basis to do daily rounding at that maternity care center, so that all of the folks who are birthing at that small rural hospital had access to daily lactation support and education. And then, because all of our staff are cross-trained, there were also a WIC nutritionist. They could do the WIC enrollments. So everybody that came in and birthed at that hospital had daily access to IBCLC support and left the hospital enrolled in WIC, and their baby was added, and they had breast pumps and everything that they needed when they walked out the door. So those types of outside the box, putting WIC into the spaces where people access other services, are the types of things that I think really help build breastfeeding support in the community for folks who cannot afford to access private practice IBCLC fees.
Nikki, your thoughts?
Alicia, that's so amazing. I just need to say that. I think to piggyback off of what you're talking about, as far as, that's the one WIC person, and everyone knows that's the one WIC person. In the Spanish-speaking community, knowing from one Spanish-speaking provider to another that wherever you're being referred, there's going to be a Spanish-speaking person there, or there's reliably going to be an interpreter, or other people that have gone there and have had success speaking in their own language with their providers is huge. And so I haven't had the personal experience of necessarily doing that myself yet, but I think I've heard stories from other folks who have gone from the hospital postpartum to WIC, knowing who the Spanish-speaking person at WIC is, and being able to tell their patients, like, you're going to see this person and they're going to help you out with this, like, you can trust them, is amazing. And even beyond WIC, like being able to refer to Family Connects if that is serving your community, and being able to tell them, like, they do have at least an interpreter, or they're a nurse and these people speak Spanish, like that will make people much more open to wanting a service where someone's going to come into your home and see your space, and that might cause fear otherwise if you kind of weren't really sure who these folks were going to be. I think some other really beautiful examples of collaboration is one that is near and dear to my heart. So Breastfeed Durham has been able to help give out some free pumps to folks who aren't able to access them through WIC or their insurance. And we've been able to get buy-in from lactation consultants at different Duke health facilities to give folks the referral form when they're seeing that they're having these barriers to getting a breast pump. And we've delivered so many pumps, like at least 60, if not more, over the course of the year. And I think that's been an amazing way to show that, our healthcare system does know that there are community resources and has found a way to connect with them. I think one other example, or a couple others of successful collaboration interdisciplinarily, is Duke, run by Dr. Dotson, has quarterly breastfeeding work group meetings where nurses, doctors, community members, really kind of anyone that has anything to do with lactation can come together and talk about efforts that are ongoing and where more support is needed. And so it's a nice space for people to stay connected with how we can better support our lactating families. And then I'll just add too, recently, Anne, social worker here in Linell's IBCLC, and then a mental health provider, El Futuro, which is a mental health support office in Durham, specifically catered towards Spanish-speaking families, with the support of Breastfeed Durham and myself, came together to form a postpartum breastfeeding support group for Spanish-speaking families. And I think it's just so beautiful to see how folks with different training can come together with a shared interest and passion to support a specific population to help kind of foster these spaces where folks can get the support they deserve.
Thank you all so much. I think one of those big themes was community engagement. I heard that from each of you. Question for Stephanie and Kim that I'd love for you both to weigh in on. How can different healthcare professionals better coordinate to support lactating families from diverse backgrounds?
So I will start with something that, if you're in the lactation community, can feel obvious, but it is not to a lot of people, and that is offering culturally congruent services, making sure that you employ people from diverse backgrounds and backgrounds that represent people that you service. You know, if you have a group of people that heavily patronize your services, then you should have somebody there that reflects that, because they're going to have more insight to cultural norms, to maybe things that are a little bit more sensitive, and be able to speak on that and be able to speak to them in a different way. So I think that's number one. Also, making sure that we are actually taking the time to continuously take cultural competency, like classes, webinars, sessions, whatever. It's not a one and done. You take one, that's great. You read a great book, you're like, I love it. And you think that like, you know all of the things now, but when you don't have that lived experience, you're getting one perspective from that book or that person. It has to be a continuous series of lectures and webinars and classes to help you with that growth, right? And also not to assume. I think the biggest thing is that assumptions get made. Even when we are healthcare workers, people, human beings, have a tendency to kind of reflect off of their own experiences and kind of put that onto other people. And so you may have a doctor who will tell a breastfeeding mother, oh, you don't need to breastfeed past 4 weeks, or, you know, whatever their mother told them, because they're not receiving a whole lot of education on breastfeeding. And maybe that's just what they think that they know. And so they're going to share that information. We cannot make assumptions about people, and we cannot make assumptions that we know everything. We have to put in the effort to do the work to learn more. And then you can kind of be a little bit more factual. You can be more understanding, and you can be more gracious with parents or people who are breastfeeding their children that are in your care. And so I think that is a really big thing, is making sure that you are always mindful that you don't know them and you don't know everything about breastfeeding. And so we have to always operate without assumptions. And I think if you do that, you'll see that people can be more open to what you're saying, because there's sometimes already a wall. Like one of the things that I heard when I heard Amber and Bernadette talking was the theme was assumptions have been made, right, about this group of people. And so you're going, well, what if they didn't make that assumption, right? How would my reaction to them be? Would I have reacted differently? Would I have been more open? Because when you're from a marginalized community, you recognize that immediately, and you kind of have to operate in a way that you need to be prepared for any backlash that you might receive. And so I think if we keep that in mind, that it's not personal, it's not about me as, you know, the healthcare provider, it is about the patient, and they have every reason to feel nervous or any kind of way, then you're opening yourself to allowing this person to be vulnerable to you and to share information with you that they may not have felt comfortable or safe sharing with you originally. And so when we take that time and we really hear patients and hear parents, and don't make assumptions about what they will or won't do, and remember that sometimes, even if somebody displays all of the checkpoints of what you think of that marginalized community, sometimes they just don't know. And so if you even mention it, that can be the change that they need, right? Like when I had given birth to my firstborn child, I never saw breastfeeding. It wasn't something that anybody in my family had done, and I knew that I wanted to do it. And so I went in knowing that. And so I was kind of headstrong in that. And the nurse at the hospital, she said to me, when I told her, she said, oh, that's great. I had to bring it up to my healthcare providers. Nobody mentioned it to me. And she told me about La Leche League, that has since spiraled, but like just planting that seed to somebody about a resource or something that they don't necessarily know can change the trajectory of their life. It can change how they care for their children and choosing to breastfeed. You know, I think we get stuck on not mom shaming or making parents feel bad about their choices. That doesn't mean that we don't offer support and let them make the choice that's right for them.
Yeah, and I think along with what Stephanie said, I think it highlights the importance of healthcare providers to collaborate and to actually listen to their families that they're working with rather than making these assumptions. Maybe, ask the parents, what are their plans? How do they plan to feed their children? And, listening to why they choose to do the things that they do to raise their children. And I think it's important to make it more family centered and then streamlining that communication. If you made that connection with your family and you want to refer them to different services, you had to have a conversation and build a rapport with that family in order to get that out of them. Because if it's the first time they've ever seen you, and that's going to be the only time they ever see you, they're not likely to open up to you and, be vulnerable and share the types of challenges and barriers that they're experiencing. And so, it's important, that like we said before, if there's that one WIC person or that one person that they felt heard by, that healthcare professional, communicates those needs to the next person that they're being referred to, and that there is a follow-up service to that. And that, you're not just referring a family and then that's it. I think it's important that practitioners and health professionals follow up on that. It's like, hey, I remember that family I referred to. Were they able to get the services they were needed? Was there anything else that came up? And I think that's important in making families feel heard and feel safe in sharing their experiences and opening up more and understanding what types of cultural barriers there may be, what kind of linguistic barriers there may be, and culture is always changing as well. So it's important for us to keep ourselves updated as well in working with families and, expanding lactation support or, feeding support in general.
And any questions for us in the chat that we should go over, review comments?
We don't have any questions so far, but we do have a comment that I think is a great point from Lena. I don't know if you want to come off mute and speak to your point, or I'm happy to just read it from the chat.
Sure. Hi, I'm Linels. I'm a bilingual lactation consultant in Guilford. Well, I was in Guilford County, and I had a very fulfilling experience working there. And I was sharing this with Nikki today. Guilford County was rough for me when I got there, but at the end I managed to connect with the important people to make breastfeeding work for families. So I have experienced everything that you guys have said. I think it is very, very important to have, and for us to know who are we referring to, who is this family going to see, and that regardless of the community where this family belongs to, or their preferences, or it just gives them that extra layer of comfort when you say, hey, you're going to go here and this is a great peer support person, or this person is going to come to your house and they're going to bring this and this and this for you. And that is very important. But what I was trying to say is, Stephanie, you were talking about time and taking time, to build up in our knowledge and our training, and I think we also need to build up on time when we are interacting with people. Many times I was like, hey, your production, you're not being productive enough, you're not seeing enough patients, we have so many patients to be seen, but we're actually deserving these patients if we're rushing, right? So I I feel like if I'm working with one family, I want to do right, at least with that family, than see five. And, just leaving them with half of the information or even more nervous, more stressed because I couldn't serve them well and give them everything that they needed. And we know that breastfeeding takes time. They have to be relaxed. They have to feel comfortable. They have to connect with their baby. They have to trust the process. And it does take time. I mean, it's drop by drop, right?
Wonderful. Thank you so much for sharing. Do we have I don't see any other questions in the chat, but if anybody has any questions, feel free to come off mute. If not, we'll have a little more time here at the end for questions as well. And we can, keep going through to hear from our amazing panelists.
I came off of mute because I just wanted to mention a lot of times I think when I used to work out in the community, I think lactation consultants in the hospital get bad rap sometimes. I'm not speaking for everybody, but a lot of times it's like, well, what happened? Because I could see that when I was out doing private practice and doing clinicals, WIC and things like that. Like something bad must have happened in the hospital. Why did it get this bad? Or what happened in the hospital setting? But I have to remind everyone that I collaborate with, I have to have referrals. I have to, because we're getting down now to where patients are wanting to get out sooner. Discharges are happening within 24 to 48. Most of ours stay only 36 hours at most time. That is a short window for someone like me to be able to go in and help them get to know the family. It's very intimate, with having a baby and being able to breastfeed in that situation. And the goal being to find what the mother's goal is and helping her get a good start here in the hospital. And we see too many times out in the community how things go awry between the hospital stay and patient care out in the home visit. So I can see that throughout my career. So we have placed self-scheduling for moms to go into my chart to be able to actually do an outpatient consult with me Tuesdays or Thursdays for 90-minute sessions. So they have that ability, but we also refer out to WIC immediately if they have a need. So I found really quickly when I moved here and working that to find where my support people were in the community and collaborating with them, find out who the WIC peer counselor was, because she is my personal assistant sometimes. I mean, I have that heart for my peer counselors because I used to be one. So me and her work very good together, and being able to support getting a hold of referrals for oral therapy issues or any kind of specialty treatment that these babies might need going home that we may see here in the hospital. So it is so much a huge thing for us to be able to have from here in the hospital someone to reach out to for these patients and clients too in my private practice to be able to refer to when they need that person that can come in with a specialty care or also for formula or a pump or wig. And we definitely seen that during COVID. I think we all got a lot of really super duper training during COVID to figure out who to fill in those gaps with. So in saying that, grace sometimes in the hospital because we don't get that time like I did when I was in the home visiting situation when I'm private practice. I get to spend a whole hour with these moms or longer. And so in the hospital, we may have, 10 or 15 patients and you can go as needed, but you don't really get a whole picture of everything in that emotional, hormonal arena that you're in right after delivering a baby. So, but we do appreciate so much our community collaboration. So I just want to throw that in there because I know having a hospital lactation consultant, sometimes you need that point of view. And I think that it's so important to realize that time is a restraint with some of those things. But I just wanted to add my personal thoughts about that too. But it's needed. It takes a village for sure. For sure.
Wonderful. Thank you so much, Angie, also for your input. And I can absolutely second that. I do both coverage inpatient and mother baby as well as outpatient. And it's a different, you're able to kind of build a relationship in a little bit of a different way. And I think having those folks that you can say, hey, I'm going to send you over to Angie and Angie's going to reach out to you. Just means a world of difference. So now we're gonna think a little bit about actionable solutions. So what are some ways that we can help to build these supports that we can offer to communities. So I'm going to pass it to Nikki and Kim to talk about what specific tools or resources have you found effective in addressing cultural and linguistic barriers in lactation support?
Sure, I can start with linguistic and cultural barriers as it pertains to the Spanish-speaking community. Honestly, I think the biggest thing here is just having Spanish-speaking providers who can make a connection and kind of have that personal touch and build that personal connection with a patient that an interpreter couldn't do. I can give a story from an interaction that I had in lactation space. I was finishing up my Pathway 2 program with UNC, and I was working in a hospital, and there was a Spanish-speaking patient, and so I was just chatting with her about how things were going in Spanish, and kind of seemed like a run-of-the-mill hospital pre-discharge consult. And then I just kind of started digging a little bit deeper about her previous experience breastfeeding her first child. And as we were talking, it turns out that she had a doctor in the country that she was from who had told her that her breast milk was too fatty. And so she had stopped breastfeeding pretty early in her with her past baby. And she hadn't really thought about it before, but she was kind of afraid in the back of her mind that that might happen again this time. And so she was like, I don't know if it's even worth like getting a breast pump or thinking about what it might be like to navigate going back to work and feeding and providing human milk, because, you know, maybe it's not even good for my baby. And so then I was able to share kind of the evidence and data we have around the fact that the fattiness of her breast milk probably was not going to endanger her child. And so I think that if she had just had an interaction with an interpreter and the lactation consultant who was English speaking only, they probably wouldn't have gotten to that point. And so that's just an example of like why it's so important that we seek to hire more bilingual staff that can connect more with our Spanish speaking population.
Yeah, along with what Nikki said, I totally agree. I think it's important for us to train and employ diverse practitioners, lactation consultants, any type of health professionals, so that we can create that connection and that collaboration with families. I think it's also important, to connect families, if that's what, they ask for, with different organizations that have more cultural and linguistic um, congruency to to them and their family and how they live their lives. And so, creating those connections between organizations and community members is really important, because then community members may, take leadership positions that can later on help move um, family needs and help address those family needs and highlight those in the community and bring them to the policy level and help change policy as well. I think it's also important, social media, there's goods and bads to it, but I think it's important to utilize those, because there are different ways that we can use social media to provide education and provide lactation education, because that's, in many ways, that's the only way that we can reach diverse populations that aren't able to access formal medical care. And there's a lot of misinformation out there, but I think there's also potential for using social media in different ways to provide lactation support and education and connecting people and creating a community that way.
Absolutely. Um, this kind of ties into a little bit of the conversation that's happening in the chat. And to speak a little bit to Rachel's question around how have rates for breastfeeding changed? So Love, could you discuss a little bit any innovative practices or programs that have significantly improved breastfeeding initiation and duration rates among marginalized populations?
Well, 15 years ago, they saw that Mississippi had one of the highest infant mortality rates and one of the highest disparity rates in the country. And the World Health Organization had put together the 10 steps to breastfeeding success. And for those of us who are in lactation, we know that step 10 was revised. It used to say to support breastfeeding in the community. And hospitals felt like that was overwhelming. So they narrowed it to just giving them support at discharge. But when they implemented the baby-friendly hospital initiative in Mississippi, they saw dramatic changes in infant health disparity rates. That means the number of white babies that died compared to Black babies proportionately changed, which is a big deal. A lot of things don't change disparity rates. And so the World Health Organization was really excited about this, and they wanted to lean into this community idea. So after looking at 20 years of data, and the Carolina Global Breastfeeding Institute did all this research and ask parents what they want, because people often say, "Love, we just do what you want." I'm like, no, we do what the researchers wanted to change the community, but nobody had really done it. The Carolina Global Breastfeeding Institute did not get funding for this project, but they had started it. They'd put together some volunteers. The director at the time had assigned a person who was a research assistant to just figure out how to do this beyond her FTE that she wasn't funded for. So I call that volunteering. So she started volunteering, and some other people started volunteering to implement this work. And they started in Chapel Hill, Scarborough, where breastfeeding was already pretty much normalized. But we did say to ourselves when we were looking at our neighbors, hey, everywhere you go in Scarborough, you do always see somebody breastfeeding. It does seem to be normalized. What if we try this in Durham in 2018, where our infant mortality disparity rate was 5.5? That means for every one white baby that died, 11 Black babies were dying in Durham. And a lot of things were happening. Mame was starting, Sister Song was coming to North Carolina, Born in Durham Healthy for Life was starting, because there were all these really individuals, a couple crazy people like myself, all over going, something's wrong. We have to fix this. And so we started implementing the 10 steps to a breastfeeding community right here in Durham. And you can see all these people unfortunately said my name when they really should have said this project, because that's what's been so transformative. This research, this work, these measurable steps. That's what started to change our community, where we started working with government. And it seems silly because we have the government proclaim, or what I like to say, claim our city as breastfeeding friendly. And we're going to be at the city council meeting and the county commissioners meeting on Monday next week, and then the week after, to do one last claiming as we do this. The health department has developed a policy to normalize breast, chest, and human milk feeding over the next 10 years. And those policy pieces are going to be built into every strategic plan that Durham puts forth. We're working with healthcare. Y'all, we have a long way to go, but I love that we have healthcare here. We have representation from Duke. We're seeing what's amazing happening, the amazing work that's happening at Piedmont, and we're starting to bring that into our WIC office. And I was thinking, when we have to put this program together many months in advance, but I was thinking we could have actually invited Durham WIC to start to present, because we've made so much progress in the last few years by working and talking and starting to move forward. Working with the businesses, like Bernadette said, and then working with our education systems. I mean, I have to grab this little kitty. So you see the mama cat. We've been giving this to childcare providers with little baby kittens to talk about how they breastfeed their babies. And then all of a sudden, childcare providers say, oh, now I get it. Now I see how this relates to children ages 3 to 6. And that's when they decide how they're going to feed their babies. Now I want to support my employees. Now I want to share resources with families. So I think it's an innovative strategy, and I'm going to challenge each one of you. We're going to hear all these gaps in care. We've heard them. And I do this every year. We all come together and I say, when we hear these gaps, what's the one thing that you can do over the next year that's within your capacity and your load to decrease one more gap in care that you hear? So before we leave today, I would like to invite all of you to put your commitment in the chat. And it could be as simple as, I'm going to subscribe to the Breastfeed Durham newsletter. I'm going to send one email. It doesn't have to be big.
Wonderful. I'm going to get me one of those stuffed animals. That is adorable. Love. I really like that. Um, so I think that leads right into our next kind of topic or area that we want to speak to about advocacy for change, and really thinking about how healthcare providers and healthcare professionals can leverage their position to influence and improve public health policies um, as they relate to lactation. And I'm going to pass it to Stephanie and Alicia for this this question.
So when it comes to how healthcare providers can leverage their position to influence and improve public health policies related to lactation, I think one of the biggest barriers for many people outside of knowing about breastfeeding and knowing that it's something completely normal and that they probably should do this or give it a shot is access to lactation support. And one of the simplest things is we should be like advocating for Medicaid to cover lactation consultants outside of a hospital setting, right? So if you're in private practice, one of the things that you really hear the most from other private practice lactation consultants is like, well, they can't accept Medicaid because, and though many people will offer sliding scales, but it does a disservice to lactation consultants because they're not able to charge their full fee and make a living off of the service that they're providing. But also, it is a necessity. It's not a luxury. This is something that everyone should have access to. And medical professionals have such a loud voice when it comes to things that we have access to. And I think if we can all band together and recognize and call out the importance and the need for this, I think that could go a long way in providing care and access for a multitude of people and making it kind of mandatory that insurance covers lactation consultants, because maybe you get 1 or 2 lactation visits with your insurance if you have a good insurance company. But there are so many Americans that do not have insurance for different reasons or are underinsured because they cannot afford, better insurance policies. And so if this is like basic care, right? Like, because I think that many parents look at lactation support as a luxury. Even if you're intending on breastfeeding, but you're having issues, the price barrier to see a lactation consultant can be like, you know what? I can't afford that. And do I absolutely need that when it could be the difference between a successful journey or not? And so if we are all supporting healthcare professionals, vocalizing the importance and the need for lactation support to be covered in insurance, I think that would just be extremely helpful.
I 1000% agree with you, Stephanie. I think to build on that also, while a lot of insurance agencies and Medicaid are now saying that they do cover lactation support to some extent, the ability to become in network and bill for those services is so complex, and there's so much red tape to jump through that it's intentionally creating a barrier of its own in order for the community to be able to access those outpatient lactation support services. So that's something that needs to be addressed. And that kind of ties in with one of my other points that I wanted to make, in that we have to remind the powers that be, the healthcare industry, the insurance industry, who they're accountable to. They're accountable to the community. And those big industries like to look at data, but data only tells a small portion of the story. The lived experiences of the community and the people who feed into those data points tells the rest of that story. And you have to open your ears to seeing the whole picture and recognize that the community is what needs to drive how these services are provided, how they are linked, and how they're accessed. And that's one of the big things that we're doing in the Embrace Project in Chatham, is making sure that the community knows that they are the drivers, and that the healthcare industry and the government and everybody else that's providing the services and sits in a seat of power right now knows that they are accountable to the community who are in the driver's seat, and they have to listen and they have to respond and they have to change things.
Alicia, I agree with you 100%. And I think that it's worth adding that when I was listening to Angie talk about just the time restrictions on nurses that are IBCLCs in the hospital setting, one of the first things I thought is we need to be holding hospitals accountable, right? Like exactly what you were just saying. We need to be holding hospitals accountable because it should not be that profits come over people, right? Where people cannot get these services. And yes, we used to have moms many moons ago spend days and days in the hospital after giving birth, recovering. And now, but sometimes within 24 hours in some hospitals, you are out of the door. And so that doesn't leave a lot of time for them to see a lactation consultant, right? That kind of just leaves a quick check and then you're discharged. But we have to hold hospitals accountable because I think putting it on parents is too much. They don't always know. They don't have the information to make informed decisions. And sometimes even if they say, hey, schedule it with this person, again, they might not look at it as a necessity. And it is a necessity to see somebody and talk about options for lactation. And when we are in the hospital, that is the first point of contact and it's so important to helping establish a healthy breastfeeding relationship for parents. And talking about it before they give birth is like really something that I wish we could see. Like I wish that we had more healthcare professionals talking about breastfeeding, pumping, all these things before they actually deliver their babies. One of the most meaningful interactions I've had with the healthcare provider was when I was pregnant with my second child, before I got pregnant with my second child. And I was a big girl now, so I had health insurance and I was seeing an OBGYN and I was like, oh, I feel very mature. And she asked me what my plans were as far as childbirth. And I was so confused. I said, I have no desire to have any more kids. One is good for me. I'm not even dating. She said, but we still should talk about it. And I was so impressed by this mind-blowing model that we should talk about where you see yourself in the future. Do you want to have more children? If you don't, what are you going to like? Just kind of like opening those conversations so that it's not a complete surprise and it's not operating off of reactions, when you get there. And when we see pregnant people, are we talking to them? Are we mentioning, are you going to breastfeed? Or what are your plans? And have you seen a lactation consultant? Have you taken a class? Like opening that door for conversation beforehand so they can make informed decisions. We know that those first hours after birth are so important to lactation. What are hospitals doing? Like we have all of this knowledge about things that are beneficial to parents and to babies. Are hospitals utilizing that to make sure that parents leave their facilities feeling really cared for and like they have made the best choices possible that they can for their children? And so I would love to see hospitals kind of really set the bar higher for quality of care and expectations for how we treat our parents.
Stephanie, I would like to add to that. I try to really advocate for my patients because, if there's a medical concern, they could probably stay a day later, right? And I'm thinking breastfeeding should be considered a medical concern. It's one of the highest nutritional values we have. Why wouldn't it be a medical concern? So yeah, I've had some quite interesting conversations with being an advocate for my patients, and it does work. The conversations have to happen and be uncomfortable. But I've found with being more uncomfortable, change happens. So we've seen a huge drop in one-on-one education since COVID. Everything went internet based, which seems really nice for those that had to do it in person. But we've seen a decline in prenatal education, like I would say 90% decline. It's very much a rarity now that we're seeing a mom come in when we say, did you do a prenatal class? Would you were prepared? And 90% of the moms I see say no, even though it's a free offer with a Zoom class online daily, weekly. They're missing out on that. And I noticed with WIC as well in Salisbury here in County, everything went drive-through. There wasn't any classes during COVID. And it seems like there's just people have gotten like comfortable not doing the hard work anymore, maybe. I don't know. But I think we're seeing a very undereducated population that has it free, but they're not retaining it, or it's not pushed in that prenatal visit in that setting with the OBGYN, which I'm a big advocate to get that changed here at Novant. Because like you said, Steph, it's really important that the prenatal, we knew this years ago. Like when I first started in lactation, like as a peer counselor 30 years ago, that there was a 75% increased chance that a mom would breastfeed in the hospital setting if she had prenatal education. So that means it's 75% less if she does not. That is a big, huge deal. And it still stands firm today. It really does. And even though education is at our fingertips, it's fast, but it's attainable, but I feel like we're not retaining. And they need to hear something more than once to be able to retain it. And I agree with you fourfold about this. And so we're going to try to work hard here at Novant, getting more of that prenatal through WIC and trying to bring some of those ways back. And I think that there was good turnouts with it. I think it's important. You get a group setting, women get to talk with one another. We know that works. But you're right. It needs to start on the front end, not on the rear end. And I will advocate and will continue to advocate that breastfeeding is so much more important. If you need to stay a day and you don't feel comfortable, let your provider know. We will stay another day. It should be normalized to do that. And I don't understand why, but we're working on it. It's the truth. And I appreciate you, because when you said that, I was like, you're hitting it right on the head with that. I appreciate you for acknowledging that, because it's tough out here for us. For sure.
Wonderful. I love that so much, Angie. That is really great. And we just need to multiply you in all of the health systems so we can get that time, because that exactly is right. We just need to, it's about people, and people need that time. So I'm going to get to one more question and then make sure that we have time if there are any lingering questions. And also for folks to be thinking about their takeaway for love, and can put that in the chat now, or wait until right here at the end. So Bernadette, I would love to hear, as we're thinking about the community as kind of being central to this work, examples of how community engagement has been pivotal in supporting breastfeeding families in your area.
In my area, they've been pretty good on supporting breastfeeding in my community. For example, we started going out in the community by doing a door-to-door and just asking, going into the shopping centers and asking if they would like to be a breastfed welcome, community, and, sign up for that. And we would listen to their stories, their successes. We would listen to their unsuccessful stories. And for me, I would give them, a praise when I hear their successful stories. And I would show empathy on the stories that are not successful, and just, let them know that it's okay. It's, we have those moments where we may not can do it. We have those moments where it may be, whatever issue that you've had, it's okay. If you have any more kids, decide to have any more kids, we can all, you can always try again, because there are now resources. There are now lactation classes. There are now doulas that can help you, midwives that can help you. I just talk to them and tell them the new that's out here now, the new resources that out here now that can help them. And we've had in my community, I would say over 4 to 5 community centers that actually signed up for our breastfed welcome, partnerships, and restaurants, hair salons, barbershops. They would say, well, we don't know if we want any pictures up here, but we'll take them. We love breasts. And to have that, to just to say that they will, share our information, barbershop, that's cool, because you can't get a lot of barbershops that will, because like you said before, they're not educated enough, because they don't really know what's out here, what's going on. And some of them don't, know about the nutritionists and everything, and that we give, when we breastfeed our babies. And just connecting with dads also. We connect with dads also, by allowing them to give support to them, to show them support. Dads need support too, because they help as well. They help with getting the water. They help with taking mom to the while mom going to the bathroom, getting that shower. So they help as well. So we support our dads, and we also like Love said, go out to our child care centers. We don't just give them the curriculums. We also just had my grandson is at a child care center now, and that we went to an event and did an event for them, and did a table, and to share information with them. So we're not just out here just saying, hey, this is breastfeeding. We're out here saying, we're going to do a table. We're going to go door to door. We're going to go in the community and say, breastfeeding has these resources, and this is a norm. This is what we're going to do. We have our park signs, our signs in the park now. So our superwoman, as I call them, our community now. And my community where I live, actually in my apartment community, when we have events, Breastfeed Derm or the health department will come out and do the events for me and my community where I live. So this is how we're getting out, supporting and saying breastfeeding is here. And you'll be surprised how many people is like, okay, yeah, we can do this. Let's put our sign up there.
Wonderful. Thank you so much, Bernadette, for sharing. I want to make sure that we have a little bit of time for any questions or other comments that anyone here has, whether on the panel or a participant. Feel free to take yourself off mute. And I love seeing all of these different kind of ideas of things that people want to take away and work on this coming year.
So I got a question for everybody here, and this is just a personal survey. I don't know if I'm gonna do it yet or not. I really don't. But I've had too many fathers of patients say to me over the past year or two, maybe even 5, Angie, do you have a podcast on YouTube? Because we get a lot of bad information on YouTube, a lot of TikToks, Angie, a lot. I would love to hear more information from you. And I was signed on to a YouTube channel. I said, what? I'm 51. What are you talking about? So I keep on hearing this, and the students are with me. They said, Angie, I really think that it's doable. And I'm like, I wouldn't know a thing and have to go to my kids to get them to help me do it. I don't know a thing about a podcast. So my question to y'all is 30 years in, would you be willing to come to a podcast and hear what I have to say professionally with a disclaimer, of course, because I work in a hospital and, IBCLC and that kind of thing. But I don't know because I've heard so many things about bad information, and of course some of it would be history and some of it would be experience and some of it would be professionalism, research backed, ethical. But I've got 4 weeks off with surgery starting November the 1st, and I've got to do something around lactation. So I'm just thinking, I'm gonna try to give it a shot. I might need some help, y'all. Anybody out there that knows how to do podcasts, but I'm thinking maybe go for it and just see what happens and pray I don't get in trouble or but I don't know. I mean, how many of y'all would be willing to listen to me once or twice or maybe and let me know, or just kind of critique me or audit me? I'll let you know. I'll send it out to Love. I'll send it out to everybody if I decide to do it. But I just figured, why not? I've been doing it for a long time. I've educated but I keep hearing this repetitively, and I'm like, I don't know. I don't know what to do. But if I keep hearing it more than 3, 4 times, it starts resonating in my spirit. Like maybe I should try this. but just pray for me and hope for me and just send vibes. And maybe that's something I might have time to do while I'm home after surgery to keep myself in the mix. So to be continued. Y'all let me know what you think. Y'all let me know
So
what you think.
Angie,
I'm
the only
saying-
thing I'll say about podcasts, which is great, is it does not need to be a one woman show, and it shouldn't be as a cis straight white woman. So you can have the history part, and then you get everyone on and you do interviews, and
Oh,
that's
yeah.
how you uplift other lived experiences, other voices, other cultural things, and more than once. You don't just do one queer person and one Black person and one Latina person. You used your entire network, and because it's all virtual, I've been on podcasts, you got to figure out all the electronic stuff, but it can be around the world, right? It doesn't even just have to be your local network. So
well, my prayer has always been to go global and more diverse and more cultural intervention, but also have different perspectives, because I learned that way myself and through my students and everyone I've come in contact on the path that I've had and the journey I've had over the years. And I just think everyone has a great perspective around it. And it's just really good to open your mind to different perspectives. Even though I'm 50, I've come from a generation of a closed-mindedness back a long, long time ago, but I'm outside that now. And I think it's really, really wonderful that we have this Lactation Nation. We have this sisterhood. We have this group. We have it through North Carolina, which has grown tremendously. And I think that we all need voices. And you're right. I definitely would want to include everyone that I've ever had experiences with from day one if I could. So that's a great idea. And I appreciate you so much, Amber, for offering that. And I may to reach out to you for some help, okay? Because it's weird for me.
I see Stephanie's got her hand up, so I'm gonna pop over to you, and then it looks like we've also got a question for Amber in the chat.
So I would just say, before everybody gets off, to really go take a look at Breastfeed Durham's website, because there is a plethora of resources for everybody. And they have done the work to put this information together in one spot that's easy to find, so that you can help and refer in your community to other people that can help. And so that's a resource that I really implore everybody to go take a look at and to utilize. A lot of time is spent creating that. It's updated continuously, and it's something that is done for the community, and so that people have these resources at their fingertips. And my last thought is, I heard Bernadette talk about it. I think I heard somebody else mention it, but don't forget about dads or partners, because they, like, without their support, it can go left real quick. And I read a study one time about your partner's input on your breastfeeding relationship can actually impact it more than your familiar input. So, like, your mom and your auntie saying you should, but if your partner, your husband or your spouse says no, or they have like some type of thing against it, they won't. They're less likely to breastfeed. And so I say that to say, let's not forget about dads and parents, because like they are a part of that relationship, and we need to normalize including them in those conversations as well.
Thank you so much. Amber, I think the question is, I'm scrolling back up here because we've got so many good things. Annie, do you see it? Because now I've lost what the question was.
I have it.
Amber, yeah, there was a question about what role do community support networks play in bridging the gaps in LGBTQ human milk support?
So this is even more important, and I love the correction that's happening here, but I do have to just also look at, these are professionals, we're all in this space, and how many times have we said moms, dads, women, breasts, sisterhood, right? These are all things that I totally get. These are what make a lot of people feel invisible, unseen, unsafe, judged. And honestly, with current political climates, can we judge them? Our trans community, which is only 2% of the population, is the current scapegoat right now for all things distracting so that we can get other really crappy things passed in politics. So to answer that, what does community do here, it is all my community has, right? We do not have the assumption that we will be understood. We do not have well, there'll be a translator there, maybe. It's like the Wild West. So we have community, we have word of mouth, and we have who did you see that didn't make you feel shitty. And so kind of where we are right now in my work with Breastfeed Durham is starting with just that community piece of, here are some spaces that we know, because I know these people, that you can go for lactation help that is going to use your right pronouns or even think to ask you. And I have to say, I always call myself the low-hanging fruit as a cis lesbian who birthed a baby. I consider myself low-hanging fruit as far as lactation success rates. And yet, if you compare the rates of white lesbians who can gestate, it is still lower than counterparts. And that's the low-hanging fruit right there. And so we did our second annual Queer Family Planning Health Fair. It's the only one around in the state, which is specifically giving voice to these experiences and trying to get family law, fertility clinics, all these things, because when you're a queer family growing your family, it's not that we're the only ones that need fertility assistance and family law, but we know we're going to. Right. So it's more of an assumption. And I can't tell you just the joy of people's faces, just walking around realizing, oh, I don't have to hide myself. I can say I'm non-binary and talk to a lactation provider and ask about, what will I have to do with my hormone levels, and just realizing that that we just need to grow that, and especially in Durham, because we have such a growing queer population here. And then we already are, and we will continue to be a hub for this entire state, because you drive outside of Durham and there is nothing. So really Durham outside of Atlanta is getting just a much bigger trans, non-binary and queer population. So right now, community contact is what we have, and I want it to get better, and I want it to get to where people can expect to be respected in their medical offices, but that's just not the truth for a lot of us. If you're masculine, if you're trans, if you present differently, there's still just so much bias, and just not educated. So like someone could have a top surgery and no one tells them that, hey, do you know you could still produce milk in a way that you don't want? They're not warned. People aren't educated on gender dysphoria. And if you choose to carry and you choose to body feed, that's a whole different thing because of the mental health component. And there's just so much gap there for just picking up a phone and calling a professional. You really have to search and seek out. So one of our goals is making these connections with medical providers, making the case for this is important to get extra education on. This is important to learn about. Here's some resources. Here's some voices to uplift. But right now it really is word of mouth.
Thank you all so much for your time, your input, your thoughts. I think the only thing I could ask for tonight is more time, which to just hear the thoughts of everyone here on this call. But I'll say that my childcare took the 8 o'clock is very literal. They have returned.
Mommy.
So thanks everyone so much. And everyone take care and have a fabulous evening. Amber, I don't know if there's anything else.